Are you lacking knee mobility after knee surgery? Decreased mobility can be very painful and it can make it hard to do things like walk, sit, or go up and down the stairs. Physical therapy is critical to regain knee mobility after surgery. We will use a clinical progression of manual techniques and exercise to promote long-term mobility increases. I usually have my patients start with a warm-up. I prefer an active warm-up like the bike or a treadmill, but if the knee is still very painful, we'll start with something like heat. After our warm-up, one manual therapy technique we can use to increase the mobility of the scar is an instrument-assisted soft tissue mobilization. So when you have a scar after surgery, this can perpetuate your pain even months after you've had your surgery. Scars get less blood flow than other tissues in the area, and the scar can adhere to the tissue below, which can cause mobility restrictions. So by using this technique, I can increase blood flow to the area and promote increased mobility to help with that soft tissue discomfort and improve the range of motion of your knee. Okay, so first I'll assess how the scar is moving. So for this patient, we have a little bit less movement up here at the top. And then we'll see down here, it's a little bit more stuck to the underlying surfaces. So I'm gonna use this assessment to decide where I wanna work. So if I'm gonna start down here, I might just push a little bit and work on lifting the scar up from the underlying tissues. And I'll usually treat each area for about 30 to 60 seconds, okay? And then we can also work on how it rolls this way. So I might do some opposing motions just to promote the movement of this scar over the area beneath. And for this patient, I don't really want to dig into over the scar area just yet, so I'm just gently working on either side, but see how that scar moves even though I'm not going over it? So I can impact the movement of her scar without any aggressive or invasive techniques such as rubbing over top, and this shouldn't cause her any pain. So once we are done with this manual therapy technique, I'm always going to pair it with an exercise, like a stretch to solidify the mobility gains we've made, and that is what's going to promote the long-term retention.